Today's NCLEX review is going to be on aneurysms and dissections, so let's go. So we're going to focus on the aortic aneurysms mostly because those are the ones that they usually test you on. First, you need to know what an aneurysm is, which is basically a weakness in the wall of an artery. It can happen because of infection or of a trauma, but the most common cause is usually atherosclerosis. There are different types of aneurysms as well. Here in the picture, I'm showing you two different types where the saccular aneurysm is only on one side and the fusiform is symmetrical. Now, the biggest concern that we have when a patient has an aneurysm is a dissection. When the layers of the artery starts to split, this is called a dissecting aneurysm. Unfortunately, when an aneurysm ruptures, a person has 90% mortality. So it's very important as nurses and healthcare providers to catch the signs and symptoms before this happens. Now, do keep in mind that the most common risk factor for a patient that has an aortic aneurysm is having high blood pressure. So like I mentioned before, it's very important to catch signs and symptoms of a rupturing aneurysm, and these are the things that you have to look out for. So if a patient comes into the emergency room and starts complaining of a sharp ripping chest pain that also radiates to the back, this is a big sign that they might have a AAA. Usually this pain has a sudden onset, and another thing that you need to keep in mind is if a patient comes into the ER with excruciating pain and then all of a sudden the pain stops without any medication or any intervention, you need to run. Most likely the aneurysm ruptured and that's why the pain stopped. So the treatment options are going to be different depending on the type of aneurysm the patient has and the signs and symptoms that they're showing and if it's dissecting or not. So to diagnose an aortic aneurysm or aneurysm in general, we have to do a CT or an MRI on the patient or also an echocardiogram. Now, when a patient has or is diagnosed with an aneurysm, the treatment options is different depending on the patient, what they're presenting as in signs and symptoms, and where the aneurysm is and what classification they have. If a patient has an aortic aneurysm or an aneurysm in general that it just has to be watched, most likely they will be placed on antihypertensives because remember the biggest risk factor for a dissecting aneurysm is high blood pressure. If an aneurysm is classified as a high risk to rupture or cardiac tamponade, which could be caused due to a ruptured aneurysm, then surgery has to be taken place. If a patient presents to the emergency room and they are having a dissection, usually intubation and ventilation may be required, especially when the patient is hemodynamically unstable. And for the NCLEX, it's very important to know that if a patient has a type 3 abdominal aortic aneurysm, usually they do not do surgery and it is delayed unless the aneurysm is greater than 5 centimeters. So for the NCLEX, just know what an aneurysm is, the signs and symptoms, risk factors, and the treatment options that we went over, and you should be okay. If you have any other questions, just comment below.